So we are coming to the next mistake to avoid, which is using wrong angles when you are doing the osteotomies for the block. What do I mean with that? You see here the harvesting after doing the osteotomies in the correct position. And then the hammering part to get out the block is actually very, very short. So how do we get to these results? So the first osteotomy is done in a right angle to the occlusal plane. This helps you to find the right angle in the mouth. So because to find distances and angles in the mouth is always very complicated. So when you understand this is the occlusal plane and your first incision should be in a right angle or perpendicular to that, this will make your life easier. So this is the first cut. Again, stay away from the ramus, especially when you're starting. Then the next osteotomy is done parallel to the first one. But you see, we are starting at this balcony. We are not starting in the area of the tooth, but at this balcony, because we want to take advantage from this nice convex structure. And this is an incision which is wrong. So because sometimes I see colleagues also doing the horizontal incision, then parallel to the occlusal plane. And then we are ending up with a too small block. It's like a triangular shape. And this is something you should definitely avoid. Instead, you should do your horizontal incision parallel to what? To the external oblique line. Exactly. So in the end, we are ending up with like a trapezoid. You see it here. And yeah, then you can do either perforations crestally or also incision when you're working with piezosurgery. Both is fine. But the advantage when you are working with perforations is by doing that, we are creating a tension. And in the moment when we are using then hammer and chisel, this tension relieves and the block is almost jumping out. So a little tip, my recommendations. Afterwards, we are splitting the block then, and I think you have seen that already a lot in social media or somewhere else. Afterwards, you're splitting the block and you're scraping also this block that these plates are becoming thinner. And at the same time, you're also collecting then the bone chips. Because what is the idea of this split bone block technique of Professor Curry? The idea is that with full cortical blocks, the revascularization takes too long time. While when we are particulating a part of that, we are enlarging the surface. When we are enlarging the surface of the bone, we have more access and faster access from the blood vessels. That means we can keep that bone alive. So that makes a big difference when we do the re-entry. It's completely a different picture than what we are seeing when we are doing a full cortical block. It's vascularized, it's red bone, and this is exactly what we need. So you need not only the plates, you need also these huge amount of bone chips, and usually you can gain that from scraping the plates, for example, with a safe scraper. And I think, yeah, most of you are in love with this instrument, me too, but you will be even more in love when you're using it extraorally, because intraorally, you will always see the patient's head and their jaw is moving, while extraorally, it's all rigid. You can hold it with your own jaw, and then you can scrape it. Then the amount of chips you will collect here is much bigger than collected from intraorally. You see here, after only 3 to 4 months, the nice, vascularized bone. That's another advantage with our method. So I'm coming from a GBR school, as probably all of you. So, but the results are completely different. So usually we are re-entering that area and we have this bone powder. It's not integrated, it's white, it's not vascularized at all. What we are seeing when we are working with autogenous bone is completely different. We are really having real bone afterwards, vascularized bone, as you can see it here. And of course, we also have a much more stable results. And this may be the most important take-home message of this whole webinar. This bone will stay stable. I know the companies who are selling the substitutes, they will tell you something else. They will tell you have to mix it with substitutes, you have to cover it with substitutes, but that's not the truth. And the most interesting thing is, I mean, we all learned that when we were students. Bone is the only tissue in the body which comes to its original state after healing. So it's not like soft tissue where we have scar tissue afterwards. No, bone really becomes the same bone as before. And of course, we have to give functional loading in that area, but then this bone will stay stable. And I will also share some studies with you, even with vertical bone augmentation. And also the quality of bone chips, you see it here on the right picture, is completely different than we are used to have it when we are working with substitutes.